The Preventive Technologies Agreement has underscored the vital importance of gender in the future of sexual and reproductive health. Nicholas Kristof has declared that the 19th century was the era of slavery. The 20th century was the era of overcoming totalitarianism. And the 21st century will be the era of empowerment of women. Gender flows through everything that we have done in the Preventive Technologies Agreement and will set the standard for how we proceed into the future in achieving this goal.
Gender has long been recognized as a driver of both the HIV epidemic and poor reproductive health outcomes for women. So harmful gender norms, the widespread perpetration of violence against women, women and girls' limited access to education and economic resources, all of that combines to make it harder for women and girls to access services, to protect themselves from HIV, and to prevent unintended pregnancies. So addressing these root causes of HIV and poor reproductive health outcomes is really fundamental. And even the best service delivery innovations in terms of family planning and HIV integration may fall short of their potential if we're not also at the same time trying to address these gender-related barriers to access and care.
Fundamental to making progress on gender issues is working with youth.
Integration of gender content into the resources and materials we develop on youth sexual and reproductive health is really important because young people are a great population to be doing work on changing gender norms. They're malleable, they haven't formed all of their ideas and sort of cemented their beliefs around gender. So we've integrated a gender component into almost all of the materials and resources we've developed under the Preventive Technologies Agreement.
At the heart of the Preventive Technologies Agreement were clinical trials of microbicidal agents that women could use to protect themselves from HIV infection, with or without their male partner's consent.
There's always been tension among people who are delivering services about how much male involvement we should actually be trying to facilitate, because we understand that women who are in very vulnerable situations may not be able to. It may actually be dangerous for them to involve their male partners in their decisions about this or to ask them to use a condom. So we want women to have the option of using microbicides in a very private way without the involvement of their partner. On the other hand, partners can actually facilitate use, and they can be very encouraging and help women adhere to their use of microbicides. And so and many men would actually like to be part of this decision and would like to know that there's something that can help keep their partners safe.
The clinical trial CAPRISA-004 showed that a woman-controlled vaginal gel containing a microbicide called tenofovir provided moderate protection from HIV.
One of the interesting things that we learned from CAPRISA-004 is that some women are able to talk to their partners about using a microbicidal gel for HIV prevention, being in a study, and other women find that more challenging. We are now working with CAPRISA on a study that looks at this issue of disclosure in detail. We're talking with women who successfully disclose to their partners and to some of their partners to find out what we can do to best support their ability to use tenofovir gel in the future. We're also talking to women who found it difficult to disclose use of the gel to their partners so that we can understand how to help them in the future as well. Women who can't disclose to their partners may in fact really need to have access to something like a microbicide. We think it's very important to understand what their challenges are and to find ways to address them.
Through the Preventive Technologies Agreement, we also conducted research and analyzed existing data to try and unpack a fundamental question. How can we balance the promotion of a method that is revolutionary because it does not require men's involvement with the reality that men often play an important role in their partner's effective use of this women-centered technology? In addition, through the Preventive Technologies Agreement, FHI 360 pilot tested a gender analysis specific to microbicide introduction in Kenya and South Africa. The gender analysis identified the gender-related barriers women may face to using microbicides and potential solutions. The pilot test also allowed us to develop guidance for doing a gender analysis in other countries. Conducting a gender analysis will ensure microbicide introduction programs take gender issues into account and maximize women's access to and use of the product.